Good morning and welcome to this morning's webinar on the CARES Act. It's Victoria Beal with the LTAP Center, and we are so pleased to be partnering with our colleagues in the ODOT Office of Transit. They will be presenting the webinar this morning, and our first presenter up is going to be Chuck Dyer, the Administrator of the Office of Transit. Before I turn things over to Chuck, I'd like to go over a couple of housekeeping items. In your GoToWebinar panel box, which I'm sure a lot of you are getting much more familiar with these days, you will find 3 handouts. If you could download those handouts, they're going to be referenced throughout the webinar. If for some reason you're not able to, though, because I know sometimes technology doesn't always cooperate on everybody's computers, please note that I'll be sending those out as a follow-up email afterwards. Also, we have a question box in the GoToWebinar panel, and that's how we'll be accepting questions during the presentation today. I do ask that to make sure you know where it's at, if you wouldn't mind just dropping me a hi in there the first thing off, I would appreciate it. That way I know that everyone's been able to find it. So, and with that, I believe that's all I have. I'm going to go ahead and turn things over to Chuck. It's all yours, Chuck.
Very good, Victoria. Thank you very much, and thank you so much for helping organize this. I'm sure the transit systems. I feel like I'm talking to my dog versus a group of people. But the transit systems today, I guess I'm anticipating you guys are excited to hear about these awards and that these funds are going to be super helpful in maintaining the service as we move forward. So we spent the last few weeks trying to understand what we're able and not able to do with FTA, working with the state controlling board. And so we're finally in a position here where we feel like we can start sharing this information with you. However, I'm just going to put the precursor that we are still in the process of securing the grant with FTA. Like any other grant, we have pre-award authority. So while I don't anticipate any changes moving forward from this point, there is that sentence on the bottom of the attachments that says we are still in the process of finalizing these grants with FTA. So we wanted to get this information out to you as quickly as we can. So thank you for joining us today. The CARES Act through the Office of Transit. So what is the CARES Act? The Coronavirus Aid, Relief, and Economic Security Act, signed on March 27th. Sorry, we have a typo there. This was the $1 trillion package that was signed. $25 billion was set aside for public transit. In Ohio, it's just under $500 million that's coming to the entire state. Of the $500 million, almost 82 million, which you see there, 81,932, 297, is being administered through ODOT for the rural transit systems. And this reimbursement is 100% of all 5311 related expenses, including intercity. Initially, the initial guidance from FTA was a little more narrowed, but they quickly opened that up because of how much money there is available and how quickly they want to see that this money is spent. So this is all good news for all of us. What is eligible? All activities eligible under the 5311 are eligible. So anything under 5311, that's capitalized maintenance, operations, it's also facilities as well. Mobility management is another one. The FTA prioritizes operating expenses first. So you'll see later on how we are breaking out the allocation between operating, mobility management, capital, and intercity. And that intercity is a requirement. So it's 15% of the related expenses, 15% of the 15% of the 82 million is required to be spent in intercity. It's close to $12 million. ODOT is going to be working with HAPCAP, who is the program administrator, to develop a consultation process and application process for all intercity bus providers. So that will include some of the rural systems, and if you are part of that network, you will receive future communications from ODOT on that. So today we are going to be talking about the operating and mobility management awards. Yeah, okay. I kind of already hit this slide a little bit, but operating and maintenance is going to be announced today. Mobility management is announced today. Capital purchases, we're going to be discussing how those will be worked later on in the presentation. And then intercity is going to be through an application process as well, much like capital purchases. So without further ado, oh, look at this animated slide. Forgive me. There's how much is being awarded. So while you're looking at the PDFs and you're quickly, hastily looking for your agency's name to understand how much money you guys are going to get, you're going to notice that on the bottom, the totals doesn't match up exactly to what's on the screen. And in the PDFs that's attached is only referencing the 2020 awards. And Todd will be talking about how Todd and Olivia will be talking about how we came to those amounts for this year. Those will be negotiable as we move forward. However, the remaining dollars that's not awarded is going to be awarded for the calendar year 2021. Total of $82 million. It's a big chunk of money, folks. Macy?
Sorry, I have to unmute myself. Okay, so with this is the timeline of kind of the major milestones with this process for the CARE Act funding. So we've already gotten our allocation announcement from FTA. So from that point, we then developed our sub-allocation process, which is what each program coordinator is going to discuss with you and how we determined those sub-allocations under each project. And right now we're in the process of the TRAMS grant and trying to get that pushed through with FTA so that we can get that in place in order to do your contracts and encumbrances. We hope to have the grant executed by May 8th. March 8th. If you can't tell, I'm the one that put May in the first slide. I just can't, I don't even know what month it is anymore. You know, I've been stuck in my house for so long. So by March 8th, we hope to have the grant completely executed so that we can have encumbrances and contracts done by the 22nd. And then you will submit your first invoice by June 1st. So that is going to represent your April costs. And Todd will talk about this a little bit, but we are going to allow monthly reimbursement for operating expenses. And so Todd's going to be sending out the updated invoice that you'll be using. And with that, he'll send the schedule for due dates for invoices so that you have the whole year kind of when you need to be submitting your invoices. But first, we anticipate first payments going out on June 1st for those expenses.
So just to correct you, Macy,
You can go ahead and advance.
Just to correct you, Macy, you said March, but it was May, isn't it in May, when we're gonna have the TRAMS grant executed?
I was right the first time. Well, Chuck's supposed to advance my slide so that I can see all my dates, but he didn't do that for me, so he kind of set me up there. Yeah, so May 8th, May 22nd, June 1st. Okay, well, luckily that was my only assigned slide, so I'm not gonna mess this up anymore.
But I think at this point, we are going to get into more detail. But before we move on, and we're going to first start talking about operating and capitalized maintenance, is there any questions in the question box, Victoria?
There's one question from RTC Industries. It says they're not on the 5311 operating maintenance projects list, and they wanted to find out why.
We will follow up with them after this webinar.
They will be awarded. That's just an oversight. It's not like we're going to follow up and tell them, oh, you're not a public transit system anymore. We'll follow up and tell them what their amount is, because that was just an oversight on our part, it looks like.
Yeah, forgive us. All right, so next we're on to Todd. Todd, we're going to go ahead and share your screen.
Good morning, everybody. This is Todd Barstow. It's showing my screen here. As you guys know, I'm the 5311 program coordinator here at the ODOT Office of Transit. Going to be covering the operating capitalized maintenance costs and how we're going to be operating that program here for the CARES Act funding. How we determined your guys' budgets, and again, RTC apologize for the oversight and not getting you guys included on that. But we developed the recommended allocations for each transit system, essentially by doubling your 2020 federal award, and then adding an additional 15% of your original award for any contingencies for COVID-related expenses such as PPE and such, disinfectants and whatnot for that. The allocations you see, as Macy mentioned, are going to be for the remainder of 2020. So it's going to be April 1st through December 21st. And then the remaining funding is going to be moved over to 2021 funding to start out the year for 2020. As we go through this, we don't really have the perfect idea of how much each system is going to be spending, how quickly or how slowly that's. So we're going to be reassessing that throughout the year and making adjustments as necessary if we need to make any adjustments there. So contracts, as I mentioned, encumbrances, we are going to have to go through the contract process again. So we will be sending those out, but please know that all expenses eligible from April 1st through December 31st is going to be eligible for the 2020 funding that we have allocated to each of the systems. As I mentioned also, if systems draw down funding quicker than we anticipated, we can go and reach into that we set aside for 2021 to make sure that the expenses for 2020 are covered. And then we're going to be expending all of the CARES Act funding before we go back to the traditional 5311 funding and going back to the 50-50 cost share. So with the CARES Act funding, many of you guys know it is a 100% reimbursement. So obviously that's going to be a big change. And also, as we previously mentioned, that all expenses that are normally eligible under the traditional 5311 program are eligible under the 53 or under the CARES Act funding. In addition to that, administrative leave pay, as well as the purchase of materials and supplies related to the COVID-19 response there. Again, examples, PPE, cleaning, sanitation supplies, if there's any additions you made to your revenue vehicles to help protect these drivers and the passengers, all that's going to be eligible as well under the CARES Act funding. Also mentioned, we are going to move back to monthly invoicing utilizing Excel spreadsheet, which will be emailed to me directly along with your supporting documentation. It is going to be a single invoice, so we're no longer going to have operating and capitalized maintenance. I'm currently working on finishing up the Excel sheet to include the capitalized maintenance line items expenses in the current operating invoice Excel document, so that all of that's going to be all on one single invoice, so we don't have to submit two different invoices throughout this process for the CARES Act funding. But again, once the CARES Act funding is gone, we will be moving back to the previous process and going back to quarterly invoicing as well. One big thing here is we're already working on reimbursements, and some of you have already been in the process approved to have your first quarter invoices processed. One thing that FTA has iterated to us is that we cannot go back and make whole or match the funding that's already been processed or in the process of funding there. So the first 3 months of the year, we cannot, it's going to be reimbursed at 50-50 or 80-20 on the capitalized maintenance. So we cannot go back and make that back to 100% reimbursement on that for the first 3 months of the year. But starting April 1st, it will be 100% federal. One thing we want to talk about here is, as far as making sure that we're getting 100% reimbursement, we want to encourage all of our systems to go ahead and establish a transit reserve fund. And within that transit reserve fund, we're going to bump that up to allow each of our systems to hold up to 40% of the transit system's annual budget within that transit reserve fund. So you can expand your transit reserve, which was previously the capital reserve or capital reserve fund or capital replacement fund. So that's going to be the transit reserve fund, and we want to encourage every system to do this because essentially what we're going to be able to do is you're going to be able to move any contract revenue that you are still bringing in. You can move that into the transit reserve fund to build up that fund so that it can be used at a later date to make capital purchases or utilize it as a local match. We want to also encourage you to move your local share that's typically assigned to each of your systems into that transit reserve fund so that you can maintain that local share as well and don't lose those monies there. Obviously, you're going to have to work with your local jurisdictions there that give you that local share to make sure that they allow that. But we do want to allow you to do that so you can move your contract revenue and your local share that's assigned to you on an annual basis into that transit reserve fund to build that up to be used at a later date. One of the things that we talked about that was initially put out was the loss of revenue was going to be reimbursable for that. What FTA has come out and said is that we cannot use a projection of lost revenue. We have to use actual dollar figures that come in. So basically, you're going to be reporting your actual revenue and the maintained number, your maintained expenses. And then that's basically just going to go through the process of looking at those numbers and pulling those numbers and then using that to calculate your reimbursement. Also, just to touch on fare box, I know many of you guys have went to being fare free during this time. That's another option you guys have. If you are still charging fares, you can go fare free, and then that will help alleviate some local costs to the general public there, and also increase the safety for the passengers and staff and drivers to help avoid the contact there between and contamination between people. I do want to reiterate that if you do not move your contract revenue to the transit reserve fund, it still must be reported in your invoice, and that will be reduced off of your reimbursement. So if you are having contract revenue, or if you do reach that threshold of 40%, you will still have to report your contract revenue there, unless it's moved to the transit reserve fund. So this is just an example that I made up here to kind of show what the reimbursements would look like. On the left-hand side of the screen there is your typical, the current reimbursement process. We have our total eligible expenses, subtract out your fare box, and then that gives you the $90,000 there in this example that you can be reimbursed, and then that would be reimbursed at 50%. So your state GRF there, you're still going to have to report your state GRF amount that that was awarded to you, the contract revenue, the local share. So that gives you your local share of 50% of $45,000 to be able to draw down the federal share of $45,000. And then the CARES Act reimbursement example, again, we have $100,000 in expenses. Did not include any fare box there to show many of the systems that went to fare free. So that makes it $100,000 in eligible expenses. Again, I mentioned you do have to still report the state GRF that you were awarded. Since that is state money, that's still not coming out of your local pot of money, but that does still have to be reported. And then the contract revenue and the local share, we have asterisks here to show that these monies were moved to the Transit Reserve Fund. And then the total local share is $15,000, so that gives the new federal reimbursement $85,000. At this time, we do not have any additional reporting requirements outside of the normal requirements that we require with the invoice submissions. But please know this is a moving target. If there are any reporting requirements from the state legislature or even FTA, we will have to implement those, and we will send that out to you guys if we do have any additional reporting requirements that come about throughout this process. I think that's all I have. So do they want to take any questions there on anything that I've covered?
Yes, Todd, I think we'll ask Victoria to review that.
Yep, we've got quite a few that have come in. So the first one was how, if any, does this apply to mobility managers under 5310 projects?
I'll go ahead and tackle this. Mobility management is going to be discussed next. What Todd presented was just for the rural public transit systems.
Okay, and the next question, I think it's more related to what Todd presented on. Does this mean the funding is our match?
Does this mean the funding is what?
Our match. And that question came from Tina, so if she wants to put a clarification in, I'll be happy to read that off too. I can go to the next question, and then we'll come back to that one.
Okay.
Administrative leave pay, question mark. Right now, if someone is doing PSL, it's my understanding we specially report that on our 941.
I'm not sure what a 941 is, but essentially, if you have an employee that's on administrative leave based on your local policies and procedures, those expenses, those wages and salaries and fringes that's paid to that employee would be included in your 5311 invoice to be reimbursed.
Next question. So if someone who is normally paid through ODOT funding should not do special coding for PSL like we have set up?
What is PSL?
I'll have to ask the person to put in a definition for that. We'll come back to that question. Next one, how far back do we report revenue to get the determination on what our loss is?
Again, we're not going to be able to project, or we have to take the actual revenue versus expenses. So you would report your actual revenues and your actual expenses. Again, according to FTA guidance, we cannot make any projections, and it's only going to be starting April 1st.
Okay, and that first question I read off, Tina put additional clarification in. She said, I'm asking if the city's obligation through the general fund is now forgiven. They are now struggling to meet this given their own loss of revenues.
Essentially, yes, we do want to encourage to try and keep as much of that local funding in place for the transit systems as possible, and that's why we're allowing it to be moved into the Transit Reserve Fund. But ultimately, that's going to be a local decision whether or not the entity that provides that local share, whether or not they're still going to maintain that.
Okay, I'm going to go back to the question that had PSL in it. They said paid sick leave is what they meant. So the question was, if someone who is normally paid through ODOT funding should not do special coding for paid sick leave like we have set up.
Okay, so paid leave is a separate line item in your invoice, and those costs would be reported under the paid leave line item. So those are still reimbursable also.
Next question, do we need to request a concurrence to move any contract revenue at 100% to a transit reserve fund?
I do not need anything formal for that. I just need to make sure that you are showing your Transit Reserve Fund certification and showing how much you're moving into the Transit Reserve Fund if you already have one approved. If you do not have one approved, please email me or contact me to go through the process to get ODOT concurrence on setting up a transit reserve fund, and we'll get that established and let you know how that needs to be done.
That was a perfect answer because it answered the next question too that was asking about how to set up a transit reserve fund.
Yeah, just contact me and I'll give you the process to get that done. It does require a separate fund account set up in your accounting system, and that this funding does have to be tracked as far as what comes in into the fund, and then also have to report what goes out of that fund when you do make purchases or use it for a local share later down the road. So that will need to be set up as a separate funding account within your internal accounting system.
Next question. If someone is off because of COVID, ODOT is okay with us charging that to the grant?
Yes.
And the last question currently is, what are you expecting for supporting documentation?
At this point, it's the same process as you typically use for your invoice submissions. So we're not asking for backup documentation at this time, but you will need to have that on hand because this funding is obviously, as with any time that additional dollars or special funding comes out, it will be closely looked at and monitored. So I do anticipate that there will be reviews, and also part of the technical assistance review process, we will be looking at all that documentation. So make sure that you maintain that, that documentation.
Okay, and then a couple more questions came in. We'll do these two and then we'll move on to the next presenter. What needs to occur to establish free fares? Does ODOT need to approve first? Do we need to go through a public notice process?
What was the entire question again?
What needs to occur to establish free fares? Does ODOT need to approve first? Do we need to go through a public notice process?
You can contact me through email to let us know that you're going fare free. It does not require a formal ODOT approval. That's a local decision on where to do that. And since you're reducing fares, it does not require a public meeting. But we do ask that you advertise it and make sure that your passengers and the general public is aware that this is temporary and that you will be returning to regular fares at a date determined in the future. And then when you go to do that, we want to be able to have each of the systems advertise in advance and make sure that there's a grace period there. So, you know, a couple weeks, 30 days before you implement and go back to your normal fare schedules.
One more question and then we'll move on to the next presenter. Do we backdate the COVID time off to March 1st, or does that only begin April 1st?
All COVID expenses will be, if you did not charge COVID related expenses in your first quarterly invoice, those will be eligible back to January 20th of 2020. Other than that, all expenses will begin on April 1st.
This is Chuck. I was going to go ahead and give one last comment from myself. I just wanted transit systems to be cognizant that we are working fast to get these funds out, and Congress has too. However, there's a lot of local governments, counties and cities, et cetera, that don't have these funds, that aren't getting funds. So just understand that the rest of your local communities may not have this kind of money, and this is flowing, right, at 100% federal dollars at this amount. So just have a little political conscience on how you talk about these funds as well. You know, going out in a big press release about these funds and how rich and flush you are with these funds while your local city or your local county is struggling might not be the best political move on your half. So I just offer that consideration. And as far as the way you advertise and talk about these funds with your local governments. That's it for me.
This is Macy. I just wanted to quickly, before we move on to the other project types, on RTC's comment earlier where they were not in the listing that was provided in the handout section, I went back and investigated, and I found a couple more issues with the way the data was filtered. So I have already updated that listing to include RTC, and it looked like Sandusky and Shelby as well. And I've sent it to Victoria so that she can send that corrected version out to everyone once this is done. So I just wanted to let you know that if you don't see your name, don't fret. We'll send the corrected version out after this webinar.
Okay, on to our next presenter.
Thank you. This is Olivia Hook with ODOT. I'm the statewide mobility coordinator. I'm here to talk about the CARES Act and mobility management. With this COVID-19 pandemic, mobility management has a critical role in the statewide response to this pandemic. Currently, mobility managers are actually working very closely with EMA to serve as a point of contact for all things transportation in those counties, to assure that there is real-time information on what services are available during this pandemic. And transit systems are also extremely important in this effort, because without that cooperation, the state and local agencies would not be able to understand the current status of critical services. The project I'm working with EMA, this statement came back from them about the data. So the intended use of the information is to provide a single source listing of providers, regardless of what program or funding stream they are normally funded under, to provide a critical transportation needs for vulnerable populations in this public health emergency. By identifying all resources, communities can draw from a list that will likely exceed their normal provider list and better ensure coverage for those populations as they need for services increases and the number of providers begin to decrease, as we would have expected ongoing exposure with this pandemic we're facing. And one thing I just want to remind everyone is that mobility managers are not just there for one entity or just transportation providers or the agency they work for. They're there in the community to coordinate between all state agencies. And that's what they're doing right here. So I just wanted to explain to everybody what was going on with this. And there is a current development with EMA, and we're going to be turning out some pretty robust data that's going to definitely support the systems in the state. Community needs. So moving forward, due to the nature of this response, this request, mobility managers are now being asked to provide coverage in counties where they do not normally serve. This creates a big conflict when it comes to local match. In addition, mobility managers will serve a long-term benefit in the wake of COVID-19 by helping the riding public navigate the services as they reopen under precautions. So that's the plan. Allocation process. So utilized by this needs to be utilized calendar year 2020 program budgets will be submitted within the application cycle. Award amounts that are on the sheet, just to give you guys a good idea of how we came up with those totals, is we just took an average total project cost that eliminated the need for local match. So we just took the entire state projects and grouped them in and came up with those allocations. The allocations will represent quarters 2 through 4 of calendar year 2020. And we will keep continuing that from January 1st, 2021 until those funds are expended. ODOT may reassess allocations in a few months once we understand the cost and everything that is going to be needed in this effort. Eligible cost for under mobility management. One thing I did want to definitely include to everyone is that it would include purchasing PPE and disinfectant material, especially for those vulnerable populations that are going to be utilizing the services. And before you purchase those PPE, I highly encourage mobility managers to first contact the transit systems to see what they have on hand before you start ordering anything. So work together with your communities and make sure that you are all communicating before you start making purchases, but that is something mobility managers can start supporting and helping the communities with. Also, public information, education and outreach about what current services are still available right now amid this crisis. Identify barriers to transit. They're going to be changing. The horizon has completely changed in the past month. So coordinating new solutions to help break down those barriers and cultivating effective partnerships with the right people and the right organizations to come together to support the residents the best way we can. The reimbursement process is going to be very standard, very typical with the normal invoice process with mobility management. It'll be reimbursed quarterly. I know that Todd said he was going to be doing monthly with the 5311s, but mobility management will be quarterly, and it's going to be quarterly matched up with the normal invoicing quarterly system. So the next invoice will be due in July. So if you have any questions about that, or if you need to have a payment sooner, I highly encourage mobility managers to be in touch with me. But otherwise, that's going to be the process. There is an Excel document template that is available as a handout on this presentation. I encourage you to use that. And the CARES Act funds cannot be used as local match for the other US DOT grants. I just wanted to remind you of that. Finally, I want to go into reporting. Mobility managers are required to report on a frequent basis to ODOT on the federal funding program with mobility management. So I'm not going to add any more reports to this. I'm going to add a new section to your current report so that you can make sure that you complete the information that is required for reporting on this grant. Okay, and that's all I have for mobility management. I know we're getting close to time crunch, so I'm going to let Alex take over and we'll have Q&A toward the end. Does that sound good?
Sure, we can do that. All right, good morning, everyone. This is Alex Ewers. I'm 5339 and the Intercity Bus Program Coordinator here at ODOT. First thing I wanted to talk to everybody about is capital projects. So, as was mentioned earlier on, we have a little more than $9.5 million worth of capital projects here that are, funding for capital projects here under the CARES Act. So with that, we have project selection. What are we going to be doing with that money? First of all, we're going to be looking at, the viable unfunded projects from the 2020 5339 application. So to start off with, that means no facilities. Facility projects, including, facility purchase or construction, renovation or rehab, are not going to be funded under, any CARES money there. Similarly, we're not going to fund any other projects with CARES money that might require environmental review. However, we're going to be looking at the rest of the projects to see which ones are viable and which ones are still needed, and, start off with funding those projects. So I'll be contacting, those systems that had projects they applied for through the 5339 application here for 2020. I'll be contacting you and say, okay, hey, if you didn't get these projects previously, do you still want them? Do you still need them? And I'll work to see, which ones are still viable and needed. Additionally, we're going to be looking here at this 2021 5339 application and seeing, which capital projects should be funded with CARES money and which should be funded with traditional 5339 funding. And the hope is that, by using both pots of money there, we can fund more projects and, get more things accomplished for you guys. Some of the types of projects that can be funded there under the CARES Act with that money include, vehicles, both replacement and expansion vehicles, shop equipment, computer hardware and software, and then other support and communications equipment. Again, we cannot do, facilities, facility purchase or rehab, renovation, or anything like that with CARES money. So please just be aware of that, but we will be looking to fund as much as we can for you guys with that. Also to know, if you had not planned on, applying for any capital projects here for 2021, and so you're not, planning on submitting a 5339 application, if you want to change your mind now because there is this CARES money available, please contact me. I'll be happy to work with you to let you get an application set up here in Black Cat, unless you submit that application here for 2021. So we'll still allow you to be able to go ahead and apply for that, since there's, you know, additional funding available. So please just be aware of that. And just, you know, send me an email and contact me outside of, you know, this if you need that. And then, you know, awarding projects here for this. First of all, capital projects will not be in this first iteration here of the CARES Act grant there in trams. This is done for a reason. We want to be able to, you know, allow that operating and mobility management money to that grant to be approved first with those projects. That way you can turn around and get that money right away. Because I know that's going to be very important to a lot of you, because, you know, there are the issues of local match and significant expenses that you have. So we want you guys to get that money right away. And therefore, we're going to hold off on doing these capital projects. Additionally, we're still determining, you know, which projects to be including in this grant. So we won't wait until this process is complete. That means it's going to, you know, wait for the time for us to figure out which 2020 projects are still viable, as well as wait until the 2021 application process is complete. So that way we can see, you know, which capital projects from there need to be included in this, you know, CARES grant as well. So this will be taking place, you know, later in the year. We'll be putting in, you know, this capital project, you know, amendment into the CARES grant here in trams. So that will be a little bit later. So, you know, a little bit longer time frame for that, but you guys will be getting money for it. A couple other notes about this awarding. You know, first of all, we will still be proceeding with projects that are currently awarded for calendar year 2020 here through the 5339 program. So we'll still be proceeding with that as normal and as the funding was anticipated, which means, you know, that 80-20 match there. If you are anticipating any issues for local match for any of your 2020 capital projects, please contact me right away to discuss it. So if you think, okay, hey, I had planned on, you know, having this 20% available for my vehicles, but because, you know, my county government or my city government or, you know, my nonprofit agency, you know, is in a budget shortfall right now because of everything, and I won't have that money, let me know right away and we can try to work through a solution for that. So just contact me outside of this for that. Just send me an email or something, we'll be happy to discuss it. So again, you know, capital projects will be done, you know, later this year. We're putting that grant into trams and getting approved. And then, you know, we'll be starting capital projects after that. So just want to get started with this. You know, again, a lot of money available, still working through to see what will be funded and what won't be funded for capital projects. And then we'll be putting, you know, that selection into trams here later this year, and then let you guys get started on it then. So that's all I had here for capital projects. Did want to spend a few minutes to talk about intercity as well.
Alex, let's go ahead and pause and let's take some questions on mobility management and capital. And while you look up those questions, you know, I did want to comment that transit systems, while you may not be doing much contract revenue currently today, in the next few months you will. So there will be revenues that will be coming in. They may be low now, but we anticipate that you guys will have revenues moving forward. Victoria?
First question. For the Transit Reserve Fund, is the max balance to be kept 40% of this year's budget, which would include our current balance in the account?
Yes. Simple
Next
answer.
one. Do we need local legislation for the contract for CARES funds?
Local legislation. Macy or Todd, can you handle that one?
If you're trying to answer, you're muted.
What was the exact question again?
Do we need local legislation for the contract for CARES funds?
Do they mean like a authorizing resolution, like in order, like what, can they clarify local legislation, what they mean by that?
Liz, if you could, yes, she said yes. That's what she means.
I think that was something we were talking about internally. And Todd, can you speak to that? I know we've talked about the fact that the care funds are still 5311, like they treat them as 5311 in nature. So we're still trying to work through whether or not we need an authorizing resolution that specifically names the CARES Act. Todd, do you want to handle that question?
Yeah, I'll take a look into that and confirm that.
That's great. And we'll be sending out a follow-up to the webinar, so we can include your information in that. Next question, how long do we have to move contract revenue to our transit reserve fund once we have declared we will move a certain dollar amount?
You have it, the way I guess I understand that question, you have it until the next invoice cycle, right? Like as soon as the account's established, if it isn't already, and you have a budget surplus currently, that needs to be done through this account. I hope I understood that correctly.
I think they're trying to talk to you more. Their local process is like with the county commissioners, they wouldn't be able to move that funding until it may take an approval process through such as a commissioner session or whatnot. If that's the case, then that is fine.
Yes.
We just show that money is moved. If you want to wait till the end of the month and then put it on the next session or whatever needs to be done there to so you don't have to move money once, that's fine.
Okay. They said yes, thank you. And Todd, yes, thank you. Okay. Next question has to do with the 941 again. And the 941 is the federal quarterly report that's prepared by an employer to pay in taxes for Social Security, Medicare, and federal withholding. So this question asks, my understanding is that a staff member officially off with COVID, it is a credit to the federal 941 and not a charge to a federal grant. Do you want to get back to that individual on that?
We'll get back to that individual on that question.
David, they'll get back with you. Next question, should we track separately in our accounting system starting April 1st?
Todd?
If you're talking about in general, there shouldn't be anything that you need to do outside of or setting up any additional accounts other than the Transit Reserve Fund. Otherwise, you should still just be tracking everything in the same methodology that you typically use. Just know that it's going to be just reimbursed differently. Does that address the question?
I think so.
Okay. Next question, resources to order PPE.
As far as finding resources to order PPE, most likely your best bet is to work with your local health department or the county emergency management agency if you're not able to find those resources. Those resources between the county, the health department for your jurisdiction or the county emergency management agency that your jurisdiction is, that your system is located in, is going to be the absolute best way to find those resources if you are not able to find those on your own.
Next question, will NCR be receiving any CARES Act funding for their mobility management program?
Olivia?
You're muted if you're talking to us, Olivia.
Sorry, I couldn't find my mute button. So National Church Residences in Belmont County, I will need to actually look that up and get with you directly to make sure that that wasn't one that was left off of the list and everything. So I don't have that right now, but I will have to get back with you. Is this Carmen or Peggy?
It came from Jeanette.
Jeanette, oh good. Okay, Jeanette, I will get in touch with you and National Church Residences once I confirm this information.
One note on mobility management, we do have mobility managers in the state who serve small urban areas, and those mobility managers can't be included in the CARES Act funding because this is for Section 5311 related activities only, and Section 5311 is specifically for non-urbanized areas. So we will still be supporting those projects through our 5310 program, and we are looking at ways that we can help with the local match situation for those select projects. So if you are a mobility manager listening to this and you don't see your name on the list and you are in a small urban area, just know that that's kind of the distinction between the two projects.
Okay, the next question came in and then they provided a clarification. So I'm going to read them both off. What about 5307 programs? I received a press release that the mobility management program in my community was being awarded money, but it should go to transit, right? For my question, this is about being awarded through the CARES Act for PPE for transit.
5307 funds flow directly from FTA to the local entity, whoever's designated. So we're not going to have a role or say so in how those funds are administered, but 5307 funds are eligible for PPE. So other than that, I'm not sure how to answer that question. Maybe I encourage you to get with one of our program coordinators after this call.
Next question, can you give a little more clarification on types of services that mobility managers are able to do?
Okay, this is Olivia with ODOT. So types of services, well, we definitely want to make sure that we don't go into the ineligible projects when we go into mobility management. So of course the standard, no driving, no providing rides, no providing maintenance on vehicles. If that ever does need to change, or if there's anything where the scope of that position has to change, like for example, I had a mobility manager who they removed her from that role so she can go drive. Well, there's no more billing on the mobility management program until she comes back. So just to understand that that stuff does happen. So if it gets into the weeds too much with a unique project or something that you want to do, I understand that we have to be very flexible at this time. Clarify that with the program coordinator before you go into any activities, and so definitely get that cleared by me. Macy, I would like to leave that with you also in case there's anything you want to add.
Yeah, I think pretty much the only thing that mobility managers can't do still under the CARE Act umbrella is transit operations related. I believe there have been some requests where, can they help with delivering meals, and that kind of gets a little gray. I say yes. Really, like what I want people to think about when you're operating under this from a mobility management perspective is, are you serving the objectives of the CARE Act, which is, kind of promoting that health and safety and things like that within the community. And so sometimes mobility managers have been delivering things to people, whether it be prescriptions or meals, in order for them to stay home during this crisis and things like that. And so on that kind of thought process, it's always best to reach out to Olivia if you're kind of unsure if something goes one way or another. But pretty much we only really draw the line consistently at anything that's transit operations, if that helps answer your question. But to Olivia's point, it's always best to ask when in doubt.
Okay, I want to mention that I did upload the corrected document that Macy had emailed me into the handout panel. So if you're able to download from there, it's available. Next question, what happens to our current 5311 and mobility federal funds and grant contracts?
I'll take that. So for the existing formula grants that you were awarded at the beginning of the year, those projects will still remain in place. We have the funding obligated in a federal grant, so that money is not going to go anywhere. We've been instructed by FTA to expend the CARE Act dollars first. So essentially, we're just moving those projects to the CARE Act funds until they are expended. But those and then once the CARE Act money is expended, we'll move your projects back to those awarded projects under the traditional 5311 and 5310 programs. And at that time, we'll probably have to do some contract modifications in order to extend the period of performance, because right now it does represent a period of performance of calendar year 2020, January 1 through December 31. We anticipate the CARE Act money going into next year. So I think the only modification we'll face with that is really about the period of performance, but those will remain in place. That way we can fall back on those contracts once these dollars are expended, because it might happen at different rates for different transit systems. So hopefully that answers your question, but let me know if not, and if anybody else has anything to add, feel free.
We've got 2 more questions right now. The next one goes back to sick leave. So since transit falls under the exemption for FFCRA, can we put an additional sick leave policy in place for transportation drivers and it be reimbursed under the CARES Act through normal invoicing?
I'll try to answer that. Essentially, yes, as long as it's within your policies and procedures and is consistent. It's much like the when I sent out the information for developing a policy procedure for the administrative leave. Also along with the additional hazard pay. So to follow those same lines, it would have to be included in your policy and procedure for sick leave or hazard pay or administrative leave, whatever that effect is. And like I said, any sick leave paid out would go under the paid sick leave column as opposed to salaries and wages.
Next question. Oh, sorry.
I think maybe we should let Alex go through the intercity. There's only 2 slides on that, just so we make sure, because it looks like we only have 4 minutes left. Is that right? And I want to make sure we get all that information out, and then we can continue to answer questions. Would that be appropriate, you think, Victoria?
Sure.
Sure. All right, then. Let me pull this up here real quick as well. So, intercity. So, one of the requirements here for the 5311 funds and for the 5311 program is that 15% of that apportionment needs to be spent on a program to support and develop intercity bus service. So here for this CARES money, that's a little over $12 million here. That money has to be used on intercity bus unless, it is certified, that the intercity bus needs are already met, which can only happen after consulting with providers, with intercity bus providers. Well, that's not currently the case. All the needs are not currently met through, our conversations with the providers and through the consultation process, which is still ongoing. So those needs are not currently met. Therefore, that 12 million does need to be spent on intercity. So only 85% of the CARES money can be spent on other things. So with that, then we're still working on developing the selection process here for the intercity portion of the CARES funding. The money is likely going to be used to support the intercity bus providers and cover their losses due to this crisis, where service is down so much and revenue is down so much for this, and therefore but with this though, the use of these funds to support the providers will not be impacting ODOT's 5311F subrecipients, as their funds and their costs will be provided and covered through formula funds. So even if we use money to help out the other intercity bus providers, it will not impact ODOT subrecipients with this. Additionally, related to this, the intercity projects here are going to be on a separate grant and trams from the other CARES projects, and therefore, the delays associated with this, through still determining that selection process for the projects, still going through the required consultation process with the providers, that delay associated with that is not going to be causing delays for other projects. So your operating, capitalized maintenance, or mobility management projects are not going to be delayed as a result of this slower process here with the intercity, but it is an ongoing process, and it does it will affect a couple of you, and will also affect the intercity bus providers throughout the state, and also uses 15% of the money. So we thought you guys should know what's going to be happening with that, and that's going to help make sure that the overall intercity bus network is able to be sustained during this time period. So that's what's going on with that. So just a brief update for you guys here on this intercity process here with the CARES money.
That's great. And we do have 2 more questions that came into the chat pod. I want to be cognizant of the fact that we're a minute away from 11 o'clock. I'm happy to continue reading off these questions for responses. We are attempting to record the webinar too, and if that's successful, we'll post it and send out a link to everyone in case you do need to leave at 11. So the next question is, will 5339 projects funded for 2020 continue as scheduled?
Yes, we are currently working on getting ready to get contracts out to everyone for the 5339 projects, and then we'll be able to continue those this year. We'll be extending the time frame for those projects because of the delay in getting everything out, as well as the current situation. So we'll have more time to get them completed, but we will be getting those projects out, and they will be ongoing.
And then the last question we have right now. Oh, I take that back, another one popped in. Okay, are the admin funds to be included in these awarded operating funds?
Admin funds, I maybe ask a follow-up question. Admin funds for intercity or admin funds for traditional 5311?
Well, she answers that. I'm going to mention that yes, we are going to be sending out the PowerPoint slides after the presentation is complete. So please watch for those in your email. And she clarified it's Rule 5311.
Yeah, admin's eligible.
Okay, that is the last question we had in the question pod. So if there are no further questions, we can go ahead and wrap things up if Chuck, you and your staff are finished for the day.
Yeah, thank you everyone for your time. ODOT's going to be working on our guidance for 5311 public transit operators for the invoice. So expect to hear more from Todd, and don't hesitate to reach out to program coordinator if you should have any questions.
All right, everyone, please stay safe and enjoy the rest of your day. Thank you.
Thank you.